Morning, and thank you so much for being here. I am State Senator LaTanya Johnson. I represent the 6th Senate District, and it is such an honor to have you here celebrating the second week of Black History Month with us. We are going to have a roundtable discussion with Wisconsin state agencies. In this 2021-23 state budget, Governor Evers and his administration and the other state agencies prioritized the health and mental health and overall well-being for families here in Wisconsin, and also for the students and communities. Today, we will hear directly from these state agencies and departments about how they prioritized investments to improve the health and well-being of African American Wisconsinites in their budget request, what they see as major challenges to addressing these disparities, and what they hope to accomplish within their agencies to improve the outcomes for the African American community today and also for the future.
Hi, my name is Dee. I'm the Senior Policy Initiatives Advisor for State Superintendent Dr. Underly. She certainly apologizes that she's unable to attend this meeting today, as there's also a UW Regents meeting occurring at the same time, but she was happy that we were able to have some of our subject matter experts join me today in providing a presentation about what Wisconsin schools and the department and our collaborative partners are doing to serve students. As you all know, this has been a challenging last almost 2 years for our students, our educators, our parents, and administrators and school staff all around. What they have done to keep our kids learning, engaged, and feeling supported is nothing short of heroic. And I'd love to thank Takara and Liz, who are joining me today, specifically for their work and dedication to our schools and students across the state, and everything that they have been doing to provide the much needed support and resources to help everyone stay safe and healthy as we continue to navigate our way through a pandemic. And I'm thankful to say that I feel like our schools have been a rock within our communities to provide support and resources to families, students, and even their staff in staying up to date with their mental health and all of the resources we can possibly make available to them. So with that, I'm going to turn it over to Takara and Liz.
We're going to for that introduction, and I'll speak for myself and just say I'm really honored to be here and to share just this space with you all and to present what we've been working on within our team at DPI, and to just be in community with all of you coming from all of our different unique lived experiences. Just a little bit about Wisconsin and DPI specifically, and what the overall vision is. We're looking at every child every day, so we really are looking at that quality experience that the young people in Wisconsin are receiving and experiencing in their public schools and libraries, and that's really regardless of zip code. And as Kim mentioned, looking at both the urban, rural, every city, township population in between throughout the state of Wisconsin. And that spreads to things like education programs, enrichment programs, before and after school programs, which we also work in our team at DPI, really so that our kids can be successful. So, that's really what DPI looks at as a whole. And as Dee mentioned, that Liz and I are two content experts within our student services, prevention, and wellness team. And so our team is full of pupil services staff, our social workers, school psychologists, mental health professionals, and me, the health and physical education content expert. So we come together looking at it through mostly that health and mental health aspect, which is why I'm really excited to share with you all what we've been working on. So our vision in our team is that our Wisconsin schools are really a place where people feel healthy, safe, supported, engaged, and challenged, like in all of our schools. So we're looking at supporting the equitable distribution of resources, technical assistance, really any collaboration that we can do with our team and those schools, so that is the experience that our students feel. A graphic that we like to come back to specifically on our team is this one here from the Virginia Commonwealth University, and this is from their Center of Society and Health, and it's not DPI, it's not from DPI, but I'm going to borrow it from them for this, just so you can get kind of a visual representation of how we tend to approach our work. And we're talking about things like educational equity, agency-wide, and really health equity at the same time. And what I love about this graphic is it really shows you where those streams of influence come from. And at the top here, we're looking at education and what we know about what those beneficial and effective educational experiences offer to the people who receive them. We see them earn more income. We see them experiencing positive health outcomes, both in their behaviors, but also in the communities that they live in. And we know that that affects their health outcomes. So in looking at the health equity, there are things that students and people in communities experience on the health side that may affect their educational experience. So this balance for us, this back and forth, this reverse causality between educational equity and health equity is something that we're very aware of and very cognizant of when we are working in a mostly academic environment, but to consider the health, physical health, and mental health of the people within that community, we can't ignore one of those sides. The bottom green at the bottom there with the two arrows coming up, we're looking at those contextual factors. And so that are going to be those, that's going to be those social policies, those systems that the schools and the people that interact with those schools are working within. So it really is a collection of all the state agencies that are here on this call, but really just the individual experiences in the communities around Wisconsin. And those factors and policies are going to influence both health and education.
Thanks, Dakara. So all of DPI's work on advancing well-being for students is guided by our school mental health framework. In December, we released an updated school mental health framework, and that provides a common language and a common approach to building the systems that really promote educator and student well-being. So a key message in this framework is the idea that mental health is an asset that we can develop in school settings. And that school mental health work is not just about treating mental health challenges. It's really about providing a full continuum of services and supports that promote well-being. So in order to accomplish this, schools can build comprehensive school mental health systems. A comprehensive school mental health system includes services and supports that promote social and emotional well-being. They foster positive mental health, and they really focus on eliminating systemic barriers to well-being and success for all students and staff. There's a strong focus on staff well-being as well. So in this framework, well-being supports are really integrated into existing behavioral and academic supports rather than operating as a separate system. And that really helps with the sustainability of these supports. So a comprehensive school mental health system really increases health equity by ensuring that all students and staff have access to the prevention and early intervention and the treatment supports and services that they need when they need them, and receiving those services free of stigma. And so in our comprehensive school mental health framework, we encourage educators to first consider how our school policies and practices and programs are acting as barriers to well-being for students and staff, rather than just trying to fix the student. So the framework also recognizes the role of social influencers on mental health and helps school leaders to find opportunities to promote individual and community resilience and really leverage those positive social influencers and mitigate negative influencers with their comprehensive school mental health system. Next slide. So one of the ways that we are currently advancing comprehensive school mental health in the state is through our school-based mental health services grant program. And this is a competitive mental health grant program that's funded by the state. So the funds that are part of this program are used for the purpose of providing mental health services to students in collaboration with community health agencies. That's a major focus of these projects. So these collaborations could be for providing direct treatment services in schools, increasing access to those services by coming to students. But these community mental health providers also serve other important roles. They consult with parents and school staff. They serve on school mental health planning teams, and they provide professional development to staff as well. So these community linkages are really an essential part of an effective school mental health system. Other strategies that grantees are using are providing social emotional learning, screening, restorative practices, mental health literacy education, and mental health navigation services to students and families. So our grantees receive between $10,000 and $75,000 per year, and they're funded for 2 years. And in this biennium, $10 million was allocated to this grant program per year. And we currently have 161 grantees receiving funding. Another way that we're advancing comprehensive school mental health is through the Wisconsin Center for Resilient Schools, which was made possible through ESSER funding. And this is a statewide technical assistance and coaching network that is meant to support school and district teams in implementing a comprehensive school mental health system. So schools can request consultation or technical assistance, or even team implementation, coaching, and training. So the idea is that this resource can really build local capacity of adults to support students' mental health and develop skills. Another way that we're advancing comprehensive school mental health is by addressing the shortage of pupil services professionals in schools. So the SSPW team recently wrote for and received a $10 million grant from the U.S. Department of Education, and that's to be spent over 5 years. And this new project focuses on a few different things. One is just increasing the number of qualified school-based mental health professionals in the state, particularly in those school districts with demonstrated need. And they're doing that through different strategies that include targeted recruitment and retention activities. There's also a focus on respecialization training for existing mental health professionals to get them the certification that they need to be able to work in a school. And then lastly, there's a focus on our districts in rural areas and in qualified opportunity zones that serve American Indian students. And so the goal of all this work is really to increase the diversity in these professions to better reflect the diversity of Wisconsin's student population. We also do a lot of work on mental health promotion within our schools. So mental health promotion activities are those that focus on promoting social and emotional and behavior skills and well-being in our students. And they're really designed and delivered to meet the needs of all students, regardless of whether or not they're at risk for developing a mental health challenge. So one area that we focus on is mental health literacy. We've used ESSER funding to increase access to youth mental health first aid training, and that's an evidence-based mental health literacy program for adults that work with adolescents. And it provides information on adolescent development, stigma reduction, and it provides a process for those adults that are working with youth to respond to students when they're having a mental health crisis. DPI also recently released mental health literacy units of instruction, which are free for schools to access. And we also provide implementation supports for educators. So these units take a skills-based approach to increasing mental health literacy, and they are available for elementary, middle, and high school students. And then lastly, in this area, DPI recently released a stigma reduction toolkit. We recognize that mental health stigma is a significant barrier to treatment in many communities. And so this toolkit is really geared towards students, educators, and caregivers with the hope that the activities and tools included in it can be a catalyst for some discussion that can lead to some perspective shifts related to mental health and mental health treatment. Additionally, DPI continues to support schools in implementing trauma-sensitive schools. So we define a trauma-sensitive school as a school that infuses the guiding principles of safety, trust, choice, collaboration, empowerment, and cultural responsiveness into all of their programs, policies, and practices. So in a trauma-sensitive school, the staff acknowledge the high prevalence of traumatic exposure for students. They know the importance of staff well-being, and they strive to meet the unique needs of all learners. So right now, DPI supports regional implementation of trauma-sensitive schools, provides training and technical assistance through our CISA partners. A specific trauma-sensitive strategy that we also support is restorative practices. So DPI has used ESSER funds to increase access to training and support in restorative practices. And we know that restorative practices in schools are meant to help students understand when they harm others and provide a process for restoring safety and relationships so that learning in a caring environment can resume after that. So restorative practices are really a good alternative to exclusionary disciplines such as suspension and expulsion. And then lastly, DPI also uses federal grant funding to support educator wellness, which has become more crucial than ever during the pandemic. So we support training and implementation in the Compassion Resilience Toolkit, and that toolkit seeks to provide school leaders with tools to build a healthy staff culture. Additionally, we have some programming around peer-to-peer suicide prevention. We offer prevention grants that focus on training Wisconsin students to recognize the signs of suicide in their peers. And they use messages of hope and health and strength to develop peer leaders. And the idea with these programs is that students are most likely to turn to their friends and classmates in troubling times. So we want students to have the knowledge and tools that they need to be able to recognize those warning signs of suicide and depression and be able to help their friends. And lastly, our universal mental health promotion activities continue to focus on advancing social and emotional learning. So we provide resources, training, and support in implementing SEL. And we know that SEL can help address various forms of inequity in schools and really empower students and adults to co-create thriving schools.
So when it comes to health education, that both encompasses a lot of the mental health, programs or approaches or frameworks that Liz mentioned. And I'm excited to be partnered with them. And I'm glad that health education works so closely with that section of DPI. And so we're also looking at the physical and social health when we think about health education. So in part of that work, we're looking to increase that statewide access to the different trainings and tools that we're either funded to do or have created through DPI to recognize that role of health equity and that balance that we mentioned with between educational equity and health equity. And that also allows us to address the disparities that we do see within the resources, money, systemic policies in health and wellness that we see affect educational equity in a school community. We're also looking at using tobacco and vaping prevention content, especially in historically marginalized and targeted communities, including BIPOC communities, specifically in Wisconsin. And that being an area that we have strong data to support that BIPOC communities are targeted by tobacco and vaping companies to engage in this risky behavior. And we see that tobacco is still the leading cause of preventable death in Wisconsin. And I believe the latest statistic was it cost the state of Wisconsin about $4.2 million in public health funds across, it's various communities, but looking at how health education can play a role in addressing that disparity. Also within health education, similar to the mental health literacy curriculum units, we're looking at the distribution of free and widely available resources that we're lowering that barrier to evidence-based, scientifically accurate information, best practices by, making it at a cost. The other thing to note about health education is that our health education standards, they're on the older side, one of the last set of standards to be revised most recently. And a lot of that early revision process does include input from the public. So that's a really great place to engage with that process. And it's already worked into the process to go, meet with our stakeholders and allow the public to involve themselves in what they would like to see with those health education standards. The Youth Risk Behavior Survey is another tool and database that is housed on the SSPW team. So we are really looking at this survey to monitor health risk behaviors, and we'll call it YRBS here for short, but we're really looking at monitoring those health risk behaviors in students that are in middle school and high schools in Wisconsin. Now we were delayed because of the pandemic, but look, we just completed the fall of 2021, the YRBS. And so we're excited to be analyzing the information right now and looking to put out the results of that spring, summer of 2022. And that's a process that schools can opt into, but we also collect like a sample. So this data is something that informs our decision-making processes about resources, technical assistance, our initiatives to address both educational equity and health equity. But a school themselves, they may also use that, looking at their data to see what their needs are and what the health risks behaviors are of the specific students that they have there in front of them. And what I love about the YRBS is that it's not an adult taking a stock of the health risk behaviors. It is student reported data. This is what they are experiencing. This is how they are feeling about these health risks. So when looking at representing that student voice, this is a really great tool to be able to do that. And lastly, stakeholder engagement is huge, and we really look to engage with the public, the school communities, all of our external partners as often as we can. And so, all the different ways that you can provide feedback or input, but just recognizing that the voice of the communities and the students and families that we work with is crucial to our work. We cannot be effective in the work that we do without that feedback and input from everybody in every community.
I know the governor put in this budget $75 for each student who was from a family with who was from a low-income family. How does DPI plan to address this in the next budget, and how additional funding for low-income students would help to make up some of that, I guess, fluctuation or inequitability, if that's a word, I didn't just make that up, compared to kids of color and their white counterparts?
This is going to be Dr. Underley's first budget she gets to propose to Dr. Evers as governor, and in her role as state superintendent. The 21-23 budget was proposed with Dr. Carolyn Stanford Taylor as our superintendent, and then presented to the governor, which he incorporated the vast majority of what we had done. A lot of it, admittedly, I worked for all three of the folks I just mentioned, and so a lot of that work Dr. Carolyn Stanford Taylor did carried over from what Governor Evers did when he was state superintendent. Part of that did include a weighting mechanism on our per pupil funding. Per pupil is a little bit different, right? Because it goes to every district based, no matter your economic circumstances, no matter your tax revenue that you derive from property taxes, et cetera. It's a blanket payment for a certain amount to every student. So the reasoning behind adding a weighting mechanism to that was to provide some additional supports to students who may come in to the classroom or start their school day with more challenges than other students, or just bring extra things. And that included our students who come from lower income households, our students who are experiencing homelessness or out of home care, and then or foster care students and youth, and then also our English learners as well. And it was a recognition that those students, public schools serve all students who come through their door no matter what. Our goal is to meet that student's need no matter what it is every day. And so the recognition of that per pupil weighting was to show that since no matter what, you need to provide every service that student needs to be successful. And sometimes that can drive money away from the general classroom purposes to provide those extra services as they ebb and flow, right? You may not always have that student. They may come in for 1 year or even just a semester. That doesn't mean you don't need the support staff to serve that student and the services to support that student. So it was sort of a recognition that we know that those students require extra funds, and we want to make sure that we are still providing the baseline for every student and not shifting funds to away from the general classroom purposes to provide the extra support that we know is needed to make sure those students have a successful learning experience. And I don't want to take the whole time talking, so I'm going to just flip. I know Takara had some thoughts on that as well. But I will say before I move over is that will certainly be something that is under consideration, I think, for our next budget proposal by Dr. Underly. But we're also planning to have a lot of parent and student engagement voices going forward about what our parents and students would also like to see in their classrooms and schools as we start our next budget writing process, to make sure that we hear that voice directly from those who we serve. We hear from a lot of the associations and our educators, and we just also want to make sure we're magnifying that parent and student voice as we're developing the next budget proposal, which we will forward to Governor Evers for his consideration in this fall of 2022.
You did a great job, I think, summing that up from like the budget aspect and just looking at different things like we have the YRBS and equitable would be really looking at the community's specific needs. And that would be giving those communities what they need when they need it. And sometimes that doesn't come from a budget initiative. It does come from those external funding sources or work within DPI to provide that type of care that's necessary for that community without thinking that it's a blanket initiative to all communities of color, because that may not serve the specific need of that specific community. So I think it can be, it's great to see additional resources given to a big initiative, but I think that the tools that we have at DPI, like the YRBS and like our specific technical assistance, allows us to be reactive in a positive way, but also proactive in looking at the trends that we see in certain areas or within certain communities to make sure that it's the right level of care and the specific care that that community is looking for help with.